And with COVID cases dropping across Canada and with hospitalizations on the decline, the travel industry calling for an end to PCR testing for both domestic and international travelers. And they've got some top infectious disease specialists supporting them. Sean Cowan has more.
Tourism Association of Canada says there are many places that are ready to welcome back more travelers, and it's time to make the trip easier.
But Canadians tell us they are eager to travel, and Canadian tourism businesses are ready to welcome the world back to Canada.
The travel industry says PCR testing is now an unnecessary obstacle, so it's calling upon the federal government to get rid of it, and a couple of doctors from McMaster agree that it's time.
In terms of trying to prevent Omicron from coming into Canada, when 10 to 30% of your local population already got COVID-19 over the last 2 months, it really, becomes a little bit futile to try to prevent it coming over the border.
Dr. Zain Chagla not only says PCR testing is out of date because it can show a positive result 6 months after infection, they are also very expensive.
Hundreds to thousands of dollars to pay for their families to get tested to return to Canada. They're at the expense of countries that can charge whatever rates they need so that, again, people meet the travel requirement to enter Canada. They have to meet the turnaround time for under 72 hours, which adds an additional expense.
Dr. Dominic Mertz from McMaster says testing only makes sense when you are facing an unknown virus. COVID has now been with us for over 2 years.
Canada, as well as the rest of the globe, pretty much will transition step by step into endemicity, and travel restrictions and testing at the border is not going to prevent COVID from staying here in Canada.
Ontario's top doctor believes it's time to loosen other restrictions as well. Dr. Kieran Moore says that with the peak of the Omicron virus now behind us, he says some surgeries and procedures can now gradually resume, along with extracurricular activities in schools.
The average for new admissions to the intensive care unit and the total number of patients with COVID-19 in the ICU both continue a downward trend. The percent positivity of PCR tests continues to decrease, with our average this past week declining to 13.42% from 14.64% the week prior.
And Dr. Moore says he will be making more recommendations to the government next week on what restrictions can be lifted. He says all the numbers are headed in the right direction. Sean Cowan, CHCH News.